Every renewal date comes along and you're sick to your stomach. I can't sleep at night waiting for the new package to come to tell me how much my premiums are going to go up and how much lower my coverage is going to get and how much higher my deductible is going to get. You've seen the commercials on TV, right? Get health insurance privately, really reduced rates, great, wonderful, they suck you in. Well, they suck my husband in. Have you ever had any issues with a birth? Not when. My child 22 years ago was a C-section. So here I am telling her, and she's continually asking me questions about it. Okay, any medication? She is denied coverage because of this little blip in her platelets, which are now normal, and because she went to a social worker for a couple of months. It's ridiculous.
I will let Hal tell you his story.
Thank you, David. And thank you, everyone. What did we come to when we have to stand around in the rain to work for better health care for everyone? I'm a physician. I have not done patient care for a few years, but I can tell that our health care system is critically ill. I can also tell that our insurance industry is criminally insane. So we have a chance. Right now, we have a president who actually has stepped up and wants to do something for the people. How unusual. Half the country is in shock. And here we are trying to support him. It's going to take all of us. This health care bill that's moving through Congress is like the Clint Eastwood movie with the bus running the gauntlet. Everyone is taking shots at it. You've got the people on the right wing, you've got the insurance company. This is the time to see that for the first time in our history, we can end pre-existing conditions. We can end unilateral cancellation of insurance policies. We can end discrimination based on health history, on age, on gender. So it's up to all of us to make sure that the naysayers, we talk to them, we talk to our representatives and our senators, and we tell them, we need this and we need this now. We need it to save lives. We need it to protect our protect our families from going bankrupt. We need it to heal the economy. What's a better stimulus package for this country than health care reform? We can put millions of people to work. There are studies that will show that people stuck working for a big corporation when they could start their own business and start the economy going, because we know that small businesses create, what, 100% of new jobs in the last decade if you subtract for outsourcing with the big transnationals. So I'm here to say thank you, everyone, for coming out, including the National Nurses Organizing Committee. I want to recognize them. We've got Healthcare for America Now. We've got Move On. All of you, it's going to take all of us. It's going to take all of us working together and working with our friends and our neighbors and our Republican brother-in-law, whoever it is that we can talk to, that we need this now. It's good for us and it's good for the economy. Thank you.
If two or more companies, health insurance companies, that control over 50% of the market. In Bloomington Normal, WellPoint controls 75% of the market all by itself, and in the state of Illinois, Blue Cross Blue Shield and WellPoint together control 64% of the market. That's no way to run a proper marketplace if we want to get competition. The biggest thing being debated right now in the Senate is whether or not we're going to include a public plan option. Without a public plan option, businesses like mine are just going to be laid at the feet like lambs to the slaughter in front of insurance companies. Without a public plan option, nobody is going to be able to bend this cost curve effectively. The most important thing you should be saying to Dick Durbin tomorrow, or his staff when you call his office, and I would say call Dick Durbin's office, yes, call Roland Borris' office also, although Roland's voice is not quite as strident as Dick's is on the Hill. And call Mark Kirk's office. Yes. Call Mark Kirk's office. And I was at Mark Kirk's kickoff rally, which he chose to do in Kenilworth. Let me tell you, I will bet dollars to donuts that more people in Kenilworth are happy with their health care coverage than are in Peoria and Joliet. And now Mark Kirk decides that he wants to represent the whole state. Well, he better wake up and open up his eyes and understand what's happening in this state. Because people will fall for the Franklin's talking points, but at the end of the day, what we need is for people to understand and for our elected officials to understand that we need fundamental justice in this country. And that healthcare is not a commodity to be bought and sold on the open marketplace based on your ability to pay. It's a fundamental human right that should be dispensed based on your need. And that's the crux of the conversation. Say that to Dick Durbin's office tomorrow. Show up to Jan Schakowsky's rally on August 4th at Federal Plaza. And thanks everybody for coming out and spending an hour with us.